What was the question? Formalin, crossing the protein, so it's like turning it into like concrete. So it stops it from rotting, it makes it so we can cut it and stain it and do all these things. It also kills all of the infectious organisms that might be in it, so it makes it safer for us to handle. Questions? Good, thank you. Yeah.
So a whole body, you just submit.
Give me the body.
Fast as you can.
Give me the whole body. Yeah. Please. Or if you're confident enough, you can do the necropsy yourself in practice and then send me pieces in formalin, right? We get that a lot. We call it a fixed and fresh because they'll send some fresh tissue to test for like bacteriology, virology, PCR, whatever, and then fixed for histopath. Yeah.
How long is a whole body kind of viable, like refrigerated before it's sent off for a necropsy?
That's a great question. Can you hold on to that until we talk about postmortem artifacts? Because I think the answer will become evident. Highly variable. Okay. So types of pathology, I talked about this a little bit. Anatomic is me, it's dead bodies and biopsies. Clinical is Jen Johns and Dr. Turnquist. It's FNAs, it's cytology, it's cells out of context, it's blood work and numbers. Sorry, I just glaze over when I see a bunch of numbers. Give me dead bodies and pus, please. There are other kinds of pathology. So right now I work for the state diagnostic lab. I do primarily diagnostic pathology. So that's why is my dog sick? What is this growing on my cat? There's also surgical pathology. So that's more of the biopsy side. Be like a pathologist who works at IDEX does primarily surgical pathology. It's also experimental pathology. So I've done a little bit of that. That's doing actual IFAC approved research, usually on animals as models of human disease, and then studying the pathology to see what we can learn about the disease in humans. And then I talked about ToxPath, which is basically the pathologist is kind of removed from the experiment. The experimenter wants to know, did the drug work? Is it causing damage to the body? And here's basically how that works. So we fix the tissue in formalin. It cross-links all the proteins. Formalin is just formaldehyde plus water plus a buffer. So potato, potato. We then, once the tissue is fixed, we process it, we dehydrate it, we suck all the moisture out of it, and we embed it in a block of wax. And then we cut the wax block. So that helps to kind of like hold everything in place. And then once we have sections, we can put them on a slide, we can stain them with whatever, we can do all this analysis with them. All kinds of fun stuff. All right, so now we're going to start getting into the language of pathology. Symptoms versus signs, it's kind of a subtle difference, but it's important. Humans have symptoms. These are subjective feelings that we kind of infer, but we don't really attribute them to the animal. So we don't say, you know, oh, this animal has a headache, it's nauseous, it's painful. What we're actually seeing in the animal are clinical signs. So these are the objective manifestations of disease. These are things you can observe. They don't have to be reported to you. So clinical signs often suggest symptoms. So head pressing, an animal that's pushing its head into a wall probably has a headache. An animal that's drooling, vomiting, not eating, he's probably nauseous. These are all signs of pain, but these are actually what we're seeing and reporting are clinical signs. Humans have symptoms. I can tell you I have a headache or I'm nauseous. Etiology, second new word. So etio is related to the cause. What is the cause of things? So etiology is the study of causes. There are many, many, many different etiologies. If you think about an etiology as anything that can cause disease, that's a massive range of things, all the way from infectious things to, you know, genetic mutations to trauma, toxins. A car is an etiology, right? And then also things in the environment, right? Like heat stroke. Heat can be an etiology. Anything that causes disease is an etiology. You guys heard the Damn It V acronym yet? It's my favorite. There's also vitamin D, but that's not as fun because you don't get to sweat. So I like Damn It V. This is an example that I use when I teach CNS in CISPATH next year, so something to look forward to. This is kind of an example. Get out of here. Kind of example of how I would work through this for a body system. So whenever I give you a lesion, I would like you to be able to come up with a damn it B category for it, right? And that's kind of what we're doing here. We're learning, what does inflammatory disease look like? What does genetic disease look like? What does cancer look like? What does necrosis or cell death look like? So eventually, once you get to the end of GenPath, I'd like you to be able to get to a damn it V category for a lesion, just the generic. I think it's degenerative, metabolic, neoplastic, right? Once we get into CISPath, you're going to do that like this for every organ, where, okay, I have a bucket of degenerative CNS diseases. So I can look at the tissue and say, or the clinical sign and say, this seems degenerative. What is in my category of degenerative for this organ system, right? So that's how we're going to kind of build on each other. And then don't forget, life is messy. Diseases could be multifactorial. Diseases often are multifactorial. Inflammatory bowel disease in humans is a perfect example of a multifactorial disease. It's super complex. We think there's a little bit of a genetic basis, but environment also plays a role. Diet, smoking, your microbiome, so the organisms that are commensals inside of you, your level of stress. So all of these things play together to create this disease, IBD. So there are a significant number of diseases that have a complex etiology like this, where it's not easy to figure out what is the primary underlying cause. All right, pathogenesis. Remember, pathos is the study of disease. Genesis, like in the Bible, is like the beginning, the story. How did this happen? So the pathogenesis is the full progression of disease from the very start to the very end. So for here, please don't memorize this. This is FYI. This is a written pathogenesis diagram for COVID, right? We start in a healthy person where the virus binds to ciliated cells. The etiology is SARS-CoV-2, right? The first event in the pathogenesis is it binding to the cell. We go all the way down through all of these steps to dead, right? Or recovery, whichever you prefer. For pathogens, it includes a lot of virulence factors. So you can see they're talking about ACE2. They might talk about specific virulence factors, specific host factors. So host responses, part of the pathogenesis of COVID is this cytokine storm, which is basically a host-driven toxicity, trying to get rid of the virus. So pathogenesis is all of this. How do we get from a healthy animal to a sick or even potentially a dead animal? What's the story? Here's just another way to put that if you like diagrams. Same thing, pathogenesis. We start with infection, macrophages, cytokine storm, pneumocyte injury, edema, death. All right, lesions. So now we're getting into the good stuff. Lesions are going to be the abnormalities in cells or tissues that we can actually detect. They might be functional, meaning they show up in blood work, but they're not morphologically visible, or they might be structural. If they're structural, we can see them with our eyeballs or under a microscope, still with the eyeballs. So this is the big thing in here. Big emphasis in anatomic pathology is finding lesions and interpreting them. What do they mean? So general approach to lesions, we're going to use this for the next 4 years. Recognize normal versus abnormal. It's the first step. So you guys have all had normal at this point. This is your first venture into abnormal. So knowing what is normal is the first step, so I can recognize when something is not normal. In this course, we're going to learn how to describe what's abnormal. All right, so lesion description. This is everything for pathology. Descriptors should paint a good word picture. So I always say that if you're describing a lesion to me, even though I'm going to have them up on the screen, I'm going to close my eyes and pretend I've never seen this before, and you're painting me a word picture. You're helping me see the lesion without seeing, because that's what you're going to do in practice. Hopefully, you're going to open the body, you're going to see a thing. Take a picture. That's the easiest thing, but sorry, we still have to learn how to describe it. I get that question every year. Can we just take a picture and not learn this? I love pictures, but sorry, you still have to describe. Because sometimes when you're in there up to your elbows in blood, you can't really take a picture. Life happens. So you get excited, like maybe you see a bunch of pus and you just forget everything else. You get so excited about the necropsy. I like pus, sorry. All right, so these are descriptors. The other thing about describing lesions is that you can't be wrong if you're just describing. These are objective things. They're colors, textures, shapes, smells, sizes. What does it look like on the cut surface? What color and texture is it? What is the demarcation? So if I have, you know, a lesion in the liver, here's, pretend the liver is a square. Here's the lesion. Is it really well demarcated? Like, could I draw a line around it because it has a really sharp border? Or is it kind of like, I can't really tell where it starts and stops. That's demarcation. So that's when we get to the neoplasia week, that's going to be an important characteristic for differentiating benign versus malignant neoplasms is, are they well demarcated and just kind of compressing, or are they poorly demarcated and kind of invading in? So these descriptors are important. There is valuable information here. But for someone who does not have a lot of experience in pathology, i.e. most general practitioners, this is where you want to focus because you cannot be wrong if you're just describing. An accurate description is so, so valuable. It's more valuable to me than you guys being able to diagnose things. Because you might have something weird in practice that you don't know what it is. You might have something you never even learned about in vet school, right? How are you going to diagnose that? You're not, you're going to send it to me. All right, so these are some examples of descriptors. You can really go crazy with this. Be creative. As long as I can actually see what you're talking about and visualize that in my mind, I'm totally fine with it. There is a phenomenon called delicatessen pathology, which is where things are compared to food. I am all for it. There are a lot of other pathologists that hate that. A lot of people think it's gross. It's comparing things to common object that everybody knows. If you tell me the pus is the consistency of tapioca pudding, I can picture that pus in my head, easy. Someone in last year's class described the color of something as Patrick Star pink. And I was like, yeah, okay, I know, I can see that in my mind. So whatever gets the point across, you can get creative. All right, so now I need 2 volunteers. Please. I saw this hand first. You want to be the first or the second? Okay, you be first. Who wants to be the second volunteer? Okay, 1, 2. I need you to come up to the board. And you're going to draw. Shoot, I was going to bring other colors of markers. Don't look at the screen. Go up. All right, volunteer number 2. I'm going to give to you a lesion. Okay. Yeah. Okay, so here's your lesion.
Okay.
You are going to paint a word picture for your classmate so that she can draw this lesion, having never seen it.
Okay. It is round. Well, now my mind is blanking on all the descriptor words I know.
You forget the name of that object?
I can use the name of that object? Okay, it is an orange, it's round. The top portion is moldy, it's very bumpy, Is moldy a description? No, it's green. Trying to think. I want to say it looks squishy, but I don't know if that's helpful.
Feel it with your eyes, that's valid.
The uppermost, roughly half of it is the most affected. Around the middle section, it becomes less bumpy and more like, kind of like what looks like frost and white instead of green. The bottom half of the orange does not look like it's been affected. It looks like an orange. At the very center top, in the middle of all of the bumpy green mush, is the stem, which is small, cylindrical, and looks solid. It looks hard. does not look affected. I can't see what Brent's drawing, so,
So other things you can use, other descriptors, what percentage of the tissue is affected? Said, can I say orange? That's like saying I have a liver,
okay,
right? That's like the tissue isn't orange.
okay.
I need to know what tissue you're describing to be helpful.
The exterior, the skin of the orange is what is affected.
Yeah. So do we have any idea what this looks like on the cut section?
You do not.
No clue. Yeah, so it's important to say that only the surface appears to be affected.
Okay, only the surface appears to be affected. I would say that's about 50% overall, top half is affected. With the upper 40% being the mushy, bumpy green, about 10% of it being that frosty white area.
Anybody else have anything they want to add? What does it smell like? What does it smell like?
I have no idea what it smells like, but I imagine it smells bad.
Have you ever smelled a rotten orange?
Yes, many times. Gross.
Orangey, wrong.
Yeah, like the wrong kind of tart.
So smell descriptors, sour. Oh, yeah.
Okay,
Putrid, pungent. Metallic. Anybody smell carbo yet? Smells are important for diagnosing disease.
that looks good, Fred.
Thank you very much. That's beautiful orange. Let's have a round of applause for Brent. All right, I need one more pair. We're doing this one more time. We have colors this time. Do you want to draw or describe?
I'll describe.
Okay, who wants to draw? Right there. Next time, next time. You can draw the liver. Just kidding, we're not gonna do that. Here's all your colors. All right, where? All right, hit it.
It looks like a moldy apple. The exterior is affected, affecting about,
Time
Seven.
out. Moldy.
it looks like an apple with affected exterior skin, about 70% coverage.
Let's
Wrinkled.
continue the timeout a little bit. Are you sure this is mold? Once. So here, this is important. This is the difference between description and interpretation. Fuzzy, white, mushy, brown, those are descriptors. They are objective. Moldy is an interpretation. So on the last image, how sure are we that that was mold? Like 90+% at least, right? So that one, okay, maybe we can interpret if we're pretty confident. This, I have no idea. This could be bacteria, this could be worms, right? It could be some weird fruit virus that I don't know anything about. So the less you know, the more you back up and just describe without interpreting. And it is really, that's probably the biggest challenge you guys are gonna have in this class is the difference between a description and interpretation. Okay, this is a perfect example. Moldy is the interpretation. I can't draw moldy. It can look like a lot of different things. That's the first problem. Second problem is I don't know for sure that it's mold. So if you tell me I have a moldy fruit, that's gonna send me down a route in my mind, right? That may not be consistent with what the lesion is. Thank you.
It looks like a yellow apple, affected exterior, wrinkled skin, covering about 60 to 70% brown color. Dorsally, there's a stem poking out, and this 60% coverage of the skin, the wrinkled skin. Brown. It looks soft. Lost firm. There's a depression. Also dorsally underneath there's a depression underneath the stem. Overall shape of the apple has changed to become less round on the affected right side. Oh yeah, I don't know my rights and my lefts.
What would this apple look like if you cut into it?
Unsure, maybe mushy on the inside, but I.
I
Probably
think
that.
if I'm feeling this with my eyes, that part of it looks pretty soft. Like, I feel like if I poke my finger into it, it would just go.
So could you say like most likely affecting throughout the center of the affected side? Or penetrating.
I would
within
say the lesion
affected side?
extends deeper into the apple. on the
Lesion
subsurface.
extends deeper into the apple. And probably smells rotting, like sour, fermented.
Yeah, same.
I think that's all I got.
Anybody have anything they wanna add? You said it was kind of gritty up. It does, it's kind of a gritty texture.
Usually something like a.
Definitely.
When
Yeah.
you're using the word papillary versus like, multiply nodular or multinodular, how do you differ? Is papillary smaller?
Capillary means it's like projecting, like a papilla. It's exophytic. Exo meaning out, phytic meaning growth, it's growing out.
So you could have like large papillary.
Yes, yes, like a big papilloma. This is apillary.
Does it always describe why?
Does it? Thank you. Say that again.
Does it always matter to describe how it changes from the normal side to the abnormal?
100%. One more thing I would have loved to hear in here is a description of that border between normal and abnormal. Is this lesion well demarcated or poorly demarcated? It's pretty poorly. How about the last one?
Very well.
Pretty well demarcated, right? So that tells you important characteristics about the lesion. This might be an invasive apple tumor. Not that the last thing was benign, but, all right, any last minute questions? Or I hand you over for Biz.
So in terms of like how it feels is, I feel like a lot of times we're taught not to assume anything.
Yeah,
So are we thinking like we can touch this and that's why we're describing how it?
so I use the phrase a lot, feel it with your eyes. That's gonna be based on experience. So hopefully everyone in this room has seen, touched, smelled a rotten apple, right? By the end of this quarter, everyone will have seen, touched, smelled all the different rotten organs, right? So that's what, yeah, there are for sure some future pathologists in this room. Y'all are weird. So yeah, eventually that's gonna be easy. You're gonna know what a normal. You're gonna know what a normal looks like. So you're. This is just start the game. All right, we're done. We're done here.
It's just the first day I know I'm gonna have a good English. I gotta log in.
I forgot to start my Zoom.
Oh, yeah.